Hi, I am M.Mahilakshmi, Department of Physician Assistant at SNS College of Allied Health Science. My article is based on intestines. The intestine bowl is a winding muscular tube extending from the stomach to the anus. Its main purpose is to digest food. But the intestine is not only there for digestion, it also produces various substances that carry messages to other part of the body and play an important role in fighting germs and regulating the body's water balance. Small intestine. In the small intestine, enzymes, substance produced by the body, break down nutrients such as carbohydrate, protein, fat into their building blocks. These enzymes are produced in the salivary gland in the mouth, pancreas, and in the intestinal cell. Intestinal cell absorb the building block, for example, sugar, ammonia acids, or fatty acid, together with vitamin, salt, water. From there, most of the nutrient enter the bloodstream to be carried the rest of the body. Large intestine. In the right lower abdomen, the small intestine leading into the large intestine, which is regularly 1 to 1.5 meter long. The large intestine is made up of cecum, the appendix, the colon, and the rectum, which end of the anus in the anal canal. In the large intestine, strong wave-like movement help to push the content of the intestine towards the anus. The urge to go to the toilet and empty your bowel is triggered when stool enter the rectum. If we suppress this urge, the rectum temporarily store the stool. Rectum and anus. The rectum continues from the sigmoid colon to the canal, has a thick muscular layer. It follows the curvature of the sacrum and firmly attached to it by the connective tissue. The rectum ends about 5 cm below tips of the coccyx at the beginning of the anal canal. The large 2 to 3 cm of the digestion tract is anal canal which continue from the rectum. Functions of intestines. Add a enzymatic digestion of intestinal nutrient, absorption of water, electrolyte, and the produce of the nutrient digestion. Secretion of mucose and digestive juice, exclusive of indigestible material and delivery into the colon. Intestine condition. Stomach flu interstices, inflammation of the small intestine, injection from virus, bacteria, parasites are the common case. Small intestine cancer. Rarely, cancer may affect the small intestine. There are multiple types of small intestine cancer, causing about 1,100 deaths each year. Celiac disease and allergy gluten, a protein in most breed. Causes the small intestine not to be absorbed nutrient properly. Abdominal pain and weight loss are usually symptoms. Carcinoid tumor, a beginning or malignant growth in the small intestine. Diarrhea and skin fusing are the most common symptoms. Intestinal obstruction, a section of either the small or large bowel can become locked or twisted or just stop working. Belly destination, pain, constipation, and vomiting are symptoms. Colitis, inflammation of the colon, inflammatory bowel disease or infection are the most common cases. In diverticulosis, small weak across in the colon muscular wall allow the colon lining to protrude through forming tiny pouches called diverticuli. Diverticuli usually cause no problem but can bleeding or become inflamed. Diverticulitis. When diverticulity become infected diverticulitis result abdominal pain and constipation are common symptom. Colon bleeding. Hemorrhages. Multiple potential colon problem can causes bleeding. Rapid bleeding invisible in the stool but very slow bleeding might not be. Inflammatory bowel disease, a name for their Crohn disease or ulcerative colitis. Both condition are caused colon inflammation colitis. Crohn disease, an inflammatory condition usually affect the colon and intestines, abdominal pain and diarrhea which may be bloody or symptom. Small and large intestines symptoms.